This is the Confused Mother podcast, and I'm your host, Gitanjali More. Today's guest today is Dr. Isha Bafna Jain. She is a physiotherapist, a women's coach, and nutritionist with 12 years of experience and coaching thousands of parents in the journey of pregnancy, birth, and postpartum. She has co-founded a number of different ventures. Some of them are Thoughtfoodz, Proactive9, and BumptoBurp. She's definitely going to tell us more about these things in the course of our conversation today. She's also co-authored a chapter on deficiencies in a book titled Essentials of Maternal, Infant, Young Child, and Adolescent Nutrition. So I'm a part of her WhatsApp group, Bump to Burp, and I have received so many tips related to my journey with my daughter as well. And I obviously try to help other women by sharing my experiences. So I'm really, really grateful to have her WhatsApp group. And personally, she's also a mother of two daughters. Hi, Isha, and welcome to the podcast.
Hello, Gitanjali. Thank you for having me here.
Can you tell us a little bit about your work and all of these things that you've been doing? Thought Foods, Proactive 9, and Bump to Bump?
So, should I go the short way or the long way?
As you wish. Maybe even the long way is fine.
All right. So, I am actually a physiotherapist. So, I always wanted to do something in women's health right from the beginning. So, when I was, studying, there was nothing around in our, academics, something called as lamas, wherein, it was revolving around birthing, childbirth education, natural birthing, helping moms for breastfeeding. There was no mention out there. So eventually, while I was hunting for how can I do better in women's health, I came across this word called as lamas, where even my lecturers never heard about this term. And that is when I went deep dive inside and I found lot many things about Lama's childbirth education. So I started my entire course getting qualified out there. While I was doing this, I also got myself international certification in antenatal and postnatal instruction. Simultaneously, I also conceived my first child. I started teaching childbirth education to a couple of parents out there. When I personally experienced the entire thing, from the entire bookish thing, it went more personal. Now I could feel everything that, okay,
Yeah,
pregnancy phases are these, birthing is this, and much more tough is postpartum, which I
yeah.
only realized when I became a parent myself. So that is where the entire thought process shifted after giving birth is let's not stick to birthing, Isha. Let's move ahead. I think postpartum requires much more attention. So this all started with Proactive9 birth, which was more about pregnancy only and birthing only. And then it got developed furthermore with Bump to Burp, where we were highlighting lot more on post-birth care, starting from breastfeeding to post-birth care for the mother, who's also a new mother, right? We say newborn, but she's also new mother. So new mother and
Definitely.
newborn care. And then again, the mums are lost when they start solids, altogether a new chapter. I don't know what to do with this baby, what to feed. There are so many guidelines. So I think we extended furthermore to even starting solids. I thought the entire need of getting myself furthermore qualified into this field of nutrition. So in the middle, I got myself certified as a nutritionist also to do justice to this entire field that I'm actually, dealing into. Where people have a lot of faith because they start with me when they're pregnant, and they are there together right till their, children are 2, 3, 4. They're still connected as a family. They come back to us that she's grown up now, and that is where it's kind of a link from pregnancy to there. And when I touched upon nutrition, I realized the entire fact that eating good is important, but getting the right quality is also much more important.
Yeah,
So
yeah.
that is when the birth of Thought Foods happened because our family also shifted the entire business into organic farming. And
Okay.
from organic farming, it got connected and Thought Foods happened. And yeah, short story long or long story short, these are the three things that I have mothered, so yes.
Yeah, in addition to your two children.
Yes.
Yeah. Okay, Isha, one thing I think we need to clarify for our listeners, where are you
Yes.
talking to us from today?
I'm from Mumbai.
Okay, yeah. So that I think is important also to mention that you're
Yes.
not that you're in Bombay. Yeah, great. I always say Bombay because my mother's from there, and so
Uh-huh.
I've grown up always calling it Bombay, and I find it very difficult to call it Mumbai. So
No, so
I'm
I've come
still,
from a phase where, so I'm born and brought up in Gujarat, in Surat. And
yeah.
by the time I was here and settled, it was Mumbai always. So I think that's on my tongue.
Yeah, okay. Yeah, fair enough. Yeah. So you also mentioned that you have two daughters. So what is
Yes.
it like raising them in addition to or alongside all of these other babies that you have mothers that you
I think they are
mentioned?
my best teachers, I would say. Clearly, my best teachers. They
Yeah.
teach me every single day something that I teach back to my parents out there. And I think
Mm.
I'm getting to be a better parent each day that I feel, and I'm still learning with them.
Exciting. My daughter's still very little. She's only 1.5, not even 1.5.
Oh,
So I definitely can benefit from all of these groups and the work that you do for sure. So you and I, we were talking earlier about communities, and you have created this Bump to Burp community, the WhatsApp group, and you also mentioned earlier that you accompany people or people accompany you. Right from pregnancy to the toddler age to the age of 3 or 4. So, why did you create this community and what has the response been? Why do people come and want to be a part of this?
so, yes, as I told you, the entire focus was only on pregnancy. That is where I partnered with Dr. Leena. She's one of my colleagues. And we were doing pretty well in birthing. We started with a couple of post birth classes as well. We again partnered furthermore on with Ragni Ahuja, who's also part of Bum to Burp. And we all three together understood the fact that, moms are kind of lost after birth. So they're all focused about birthing
Mm-hmm.
and what should be the mode of birth, etc. And from there on, the entire support system really shatters
Yeah.
for them, because now the center person is the baby who immediately cries if you're not attending for the needs. And the mother just,
Mm-hmm.
is baffled. She doesn't know what to do,
Yeah.
because earlier all the things were met directly via the umbilical cord in the womb, safe and sound. And here the baby is just crying because that's the language of the baby.
Yeah.
And how to identify what the baby needs, you require
Mm.
experienced people around. In our lifestyle, we are usually, there are two aspects to it. Either you are in a nuclear setup, or you are in a setup where you have your joint family. But I think there was no child in the family since last 25 years or 30 years sometimes, and the entire memory fades off. The parents have
Mm-hmm.
kind of
Yeah.
forgotten how to clean the nappy. They've kind of forgotten how to swaddle a baby. They've kind of forgotten about breastfeeding altogether, latch, etc. And though they have done it excellently well, they have forgotten. But they
Mm.
don't digest that fact well, that they've forgotten. Sometimes the ego comes, then the doctor will come up. So this is quite common in
Yeah.
India, that you are being born and brought up. I don't know, Gitanjali, you're born and brought up in India, right?
In
So
Pune. In
in Pune.
Pune.
So
Mm-hmm.
the entire importance of massaging a newborn is really at a paramount here. So here
Yeah.
the doctors will say, no massage. Pediatricians, you should not be massaging your baby. And if you want to massage,
Really?
yes, if you want to
Okay.
get it massaged, please do it yourself. No need for a masseuse, because they are the source of infection from door to door. And many a times, some wrong techniques actually really worsen, certain things in baby's health. For example, I've seen one
Mm.
of the masseuse who actually squeezed the baby's nipples because they were swollen, and which is actually quite normal for the hormones to pass from the mother to the baby at birth.
Okay.
And she squeezed it, convincing the mother that if I don't squeeze and remove, this is going to turn into a pustule. And while doing this entire
Okay.
process, she pricked the baby with the nail. The baby got infected. The
Oh
tiny
no.
baby, I think
Okay.
less than a month, was on antibiotics and so on. So there are
Mm.
many um, these sad incidences which have been reported to the pediatricians, and they are saying absolutely no. So now the battle comes here, where the mother is being told by the family, massage to karna hi hai. Sorry, coming back to English.
Mm.
So you have to
Yeah.
get you have to get your massage done, otherwise how is your baby going to grow? The community would
Yeah.
say, then how do our people getting raised up in Germany or say Australia or US without massage? They're doing pretty well. And your doctor is saying, yeah, massage is
Exactly.
good, but only parents should do. And then your mother is saying, but what if
Mm-hmm.
parents do the entire force only the masseuse can give? Your baby is not going to grow well. And the mother is in a soup
Mm.
completely. That's actually just one of the
Yeah,
example
yeah.
out there. There are so many things around and surround, and I think sometimes and many a times community are lifesavers. But again, you need to be smart enough what to
Mm.
filter, what to accept, what not, because the entire horizon of people who are there in the community are also very varied. Some may even pass judgment, some
Yeah.
may have biases on, some may just be adamant about certain things, some may be situation
Mm.
oriented. So I think you should grab information, but just accept what works well in your surrounding.
Definitely, I completely agree because you have so many voices around you in your ear, and as a new mother, you are hormonal, you are confused, you are terrified about taking the wrong decisions for your child, and then how do you filter all of this information? And I think that the key message that I always try to give anyone who talks to me is listen to yourself. You do what you think is right, and that's, I think, the most important message. Even though I live in Germany, my parents are in India. They were here for a short while and they told me a certain things. But my mother, fortunately, was open enough. She said, you know what, I don't remember so many things. But I remember also one funny thing was during pregnancy, nowadays they say you should not eat raw fish like sushi, you should not eat soft cheeses, and, there are some dietary restrictions during pregnancy. And my mother said, oh, we didn't have all this in my time, you know. But then on the other hand, if you think about it, in her time they also didn't eat raw fish and soft cheeses in India in back in the 70s and 80s. That was not the case, so it's understandable that it's irrelevant for her, and that's why she stayed out of it. But I understand this. I understand this kind of confusion. Who do you listen to? Yeah.
No, I
Mm.
think one very important thing which I keep resonating throughout all my sessions that I conduct is remember the best intuition is the mother's intuition. She knows the best for her child. But what happens, Gitanjali, is your intuition sometimes is confused with influenced, people who are influencing you around. So if they have some opinion
Mm.
and they are sometimes, I would say, maybe the wrong word, but they're torturing you again and again with their opinions, you get confused and your intuition dies then. The mother is the
Yeah.
best person who knows what is happening with the child. The child needs food, the child needs burp, the child wants to pass stools. But just supporting the mother is important, not questioning, not confusing, not giving various advices, rather understanding the
And not
mother, giving her a
judging.
time. Absolutely very important. So
Not
judgment, I think,
judging. I
comes.
think that's also important.
Absolutely. Sometimes, these judgments are also passed not just from them, but also from fellow moms sometimes, which is quite unfortunate. But
Hmm.
again, not their fault. It all depends on from where, they are being influenced again. So, yes,
Yeah.
judgments passing should never be encouraged. Like, whatever is the mode of birth, whatever the way you fed the baby, you are the best parent for your child.
Isha, with regards to the topic of judgment, I think that we are our worst critics. Like, we mothers judge ourselves the harshest because of this. Nowadays everybody's talking about the perfect Instagram mother, the perfect role models, and the cleanest homes, and everything looks like picture perfect. And then we judge ourselves. Why isn't my child like that? Why am I not doing that? Or why am I not able to do that? And so on. And I think that, I don't know. Do you have any suggestions? Like, what can you do to when you find yourself in such a situation?
So I think the number one problem that you've told is we are our own critics, and more than that, I think so many times mothers start finding validation that whether I'm a better mom or the best mom for my child, only if all these checklists have been done, which has been created by the
Mm,
community around. Uh, a simple
yeah.
guideline, which even implies for me, nobody is perfect. No mother on this earth is perfect, but she's the best for her child. So I
Mm,
think that's more important. I think Instagram and
yeah.
Facebook have been great, but sometimes what you see is not really the actual aspect. So grass is always greener on the other side, and you never know what was the behind scene of that reel or maybe that post. and stop comparing. I think everybody has their own ups
Yeah.
and downs. So do you have, so do I have. I
Mm.
have fights with my children. We cry, we laugh together, we have great days together. We have
Yeah.
sometimes our house completely up and down, like in a mess, and sometimes our house is beautiful. Sometimes there are tantrums, and sometimes there
I
are
think
not.
for 5 minutes after the cleaning lady was there, the apartment is clean for like 5 minutes after the cleaning lady was there, and then everything, obviously all the toys are out, all the books have been flung
Yes,
around,
yes, yes,
and it's
yes.
chaos again right from the beginning.
And unfortunately, we all
Yeah,
know everybody, even if an Instagram influencer who is really posing to be the perfect one, knows that nobody's
yeah,
perfect, but somehow we want to just show the good part.
yeah, definitely. So what are some of the questions that people come to you with, Isha? Like, you said that you've coached so many parents.
Okay, so common questions are, to be honest, like never ending. There's a big list. If something is just clicking right now, the top five, let me talk
Yeah.
about those. I was really shocked to read something on our BumptoBurp group very recently. It's a huge group of almost now 2,500 mothers, because there are almost eight BumptoBurp groups now that we are holding on. So,
Wow.
to be
Okay.
honest, there's a sad part and a good part. Of course, the good part is there is a huge community supporting each other. But now, no more that we can
Mm.
really intervene. I cannot really read up every chat and answer them. So we have these
Right.
sessions wherein if
Yeah.
you have doubt, you come across and you can get the information, because it gets impossible for us to answer on all the admins. But I happened
Right.
to see a
Mm-hmm.
question, Gitanjali, on the group very recently, I think just 2, 3 weeks back, where the mother is asking, how safe is it to kiss a newborn? My child is 21 days old, and I was absolutely in shock. For a while, I was like, she did not
Mm-hmm.
kiss her baby for 21 days. No COVID, no other
Yeah.
trouble, but she was just loaded with fear. The fear of kissing her own
Oh my
child.
God, so sad.
I just
Yeah.
couldn't. I mean, I wanted to just reply, and I think all the mums came and said, right away, that was the answer that mums gave to her. And I was like, okay,
Yeah,
people are right
definitely.
there. Okay. Everybody's, sane and supporting her. Let me not intervene. But yes, I think I will not say something that this was silly, but I was really, saddened with the fact that sometimes, fear can overtake you so much that you don't really
Yeah.
understand that
Mm.
should you really be avoiding such a scenario? I mean, okay, so
Yeah.
you may have these questions like, should I keep fan or AC, especially in India, because the weather is quite hot and humid?
Mm. Yeah.
Or you will have, should I put coal in my baby's eyes? Because you've seen in India, people put coal around.
Oh
That's not
yeah.
there in Turkey,
Mm.
possibly. Or
Yeah.
you would have that, when can I take my baby outside the house? When can I go for outing?
Yeah.
Or, I mean,
Mm.
questions are endless. Okay, when can I eat a fruit from a
They're
mother?
yeah.
When can I exercise? I think the questions are endless. I can go on and on and on and on.
Endless, yeah.
So,
Yeah. Oh my God, and it's so sad this story what you just mentioned about the baby, the mom not kissing her newborn baby. I remember that I was really paranoid about other people kissing
oh, that's
my
fine.
baby,
But
because I said that, okay, for my husband, for me, and my parents who were there in the first month, that was totally fine. And but my parents didn't, they were, because it was COVID lockdown when she was born. So they would come, they would disinfect and everything, wash their hands, etc., etc., before they took her. But I had a rule. When people met her, I said no kissing her. That is the only rule that I had, because of this fear of infection. But it was with other people, not with
absolutely,
myself or
absolutely.
with
So,
my husband. So I think that is okay. But yeah, fear. Oh my God, I completely understand. I was also terrified because you have this tiny little creature in front of you, and you said, "I will do anything to protect you." Right? Like your this instinct, and your these feelings just kick in, and you're like, "I'm going to do anything for you."
and Gitanjali, this happens only for the first child, to be honest. Okay, so I'm a mother of two. The kind of care,
Poor second child. I'm the second child, by the way.
the neglected one always.
Oh
So I mean, I'm the first child to my parents, and for the fact that I know the kind of attention that my elder one got, nowhere my second one can match that. Of course, she's our darling. but how she's
Yeah.
growing up. So that's the reason why, Gitanjali, our ancestors used to have some 8 and 9 and 10 kids,
Oh my God.
because
Yeah.
there was no helicopter parenting. That's again a new term. That people are
Yeah.
so much behind that child that they just don't want to leave the child, and sometimes we'll make our life a mess. We really put on those responsibility which the child is not asking, unnecessarily right on your head,
On
and
your head.
just trying to get some validation that yes, I'm a good mother, please applaud me, please speak good about me, I'm really a good mother.
Oh my God, this is definitely
Yeah, so you were
something interesting
no
because
so
my mother says that about me also. She says that I always tried everything possible to get her attention
Yeah, so that's actually
because she
correct.
was, yeah,
Because when the second child is not being paid attention to, they do all those things to grab their parents' attention that please
yeah,
focus on me. So many times I've been asked this question, Gitanjali, where they will ask me that you're working and how can you have two children? How are you managing? I'm like, you better do a second child, you'll get to know everything. So everyone is like, oh my God, I just cannot handle one. How can I think about the second one? But believe me, second is damn easy. But anyway, choice, it's your
yeah.
call. But yes, second child is easy.
I've heard from a lot of people. They say that the change from zero to one child is a lot more dramatic than from one to two
You're absolutely, first-hand
compared to the
experienced
first.
now. So you are not going to make those mistakes that you've done, and you're not going to have that
Yeah.
fear that you had. So
Isha, what, like, you also work a lot on nutrition. So can you tell me a little bit about your experience with coaching parents compared to how it used to be for our parents? We were talking earlier about uh, how parents used to raise us, and the things that they did, and how their life was compared to how it is today. So from the perspective of nutrition, how has it changed now?
again, the two things even are carry forwarded here, which is fear and trying to be perfect. So now moms come to me asking, how can I just give the best kind of nutrition to my child? So of course that's a good thing to know how you balance the nutrition, especially in this generation where we don't really pay attention what we are eating, so we are what we eat. So balancing nutrition, but really be behind it, and just sometimes fearing, oh my God, I did not give protein in one of the meals. Oh my God, I did not give carbs in the other meal is not something that I really want. Enjoy your meals, and on a weekly basis, check, is your child having a balanced meal or not? So many times there's so much behind the quantity of food, especially in India, that I've seen. In India, you get a lot of help, right? Gitanjali, starting from nanny to
Yeah.
household help and everything. So
Yeah.
you pay your entire attention on the child, and that small creature that you were mentioning becomes your project, your next project, and you want that project to be accomplished, start till end. So
And
you
perfect.
absolutely. So you'll have this set thing in your mind that my child should be consuming a bowl of, say, a porridge, and a child finished that on day one. So that's a set margin, one bowl every time. And the next week, the child is just done with, say, half, and you will be behind the child's life if the child is not consuming
Yeah.
iPad, gadgets, distraction therapy, from Alexa to books to, you have so many people around in India. You'll make somebody as a clown. They will clap for the baby. Somebody will jump for the baby. You will show
Yeah.
pigeon
Yeah.
and
Yeah.
kabutar and kawa, all the animals and birds around. And you'll feed the
Yeah.
baby just to complete the quantity that was set in your mind, and not respecting that your child's tummy is full or not. That's a
Yeah.
bigger hindrance, where I feel that quantity gets in over quality sometimes. So I conduct my starting solids is actually happening again on 24th and 25th of September, happens every
Yeah.
month once. So I've divided my session into two segments. The first one talks about the good quality food balance and nutrition. Second
Yeah.
aspect focuses on how to get the nutrition absorbed. So, what is the way of eating? So, entire lecture is dedicated out there. So, it's not just important what you eat; it's also important how you eat. So, it doesn't, if you're gobbling it down by watching something, getting distracted, and just finishing it up, no point. So, that's a bigger challenge.
Definitely something that really bothers me. I mean, I've seen, or from a bunch of these WhatsApp groups, I've heard a lot of stories of mothers who feed, or not mothers, people who feed their children by showing them some sort of show or something, and then they shove food in their mouth. And so anyone who asks for any advice related to food, feeding, solids, and so on, I always say, please avoid screens. I'm
Absolutely.
not an expert, but it's common knowledge that even for adults, it's bad to sit in front of the TV and eat your food. So for children, it's even worse. To in order to build a healthy relationship to food, right? Um,
No, but this is quite ironic, Gitanjali. Ironic because these are the same mums who will ask that what kind of motor and sensory activity that I can do with my child. And how can you forget that the best motor sensory activity is to eat
yeah,
food without any screens with your own hands? I don't know the entire culture out there in Germany, but having foods with hand
yeah,
is something that has been culturally ingrained in our Indians, right from the beginning, and it actually stimulates the entire touch sensation. So,
definitely.
you are touching, you're smelling, you're seeing your food, you're tasting it, you're chewing it, enjoying and listening to it. All five senses activated. And you want to
Yeah,
hunt for some classes for motor and sensory development?
allowing
Absolutely.
natural processes to also just take place. And even my daughter, initially, I remember when we started solids with her, she would make a huge mess. She would, our windows would be covered in food, and the floor, her clothes, our clothes. But I said, she doesn't know it's food, so I'm just going to let her play and figure it out. And then at some point, she licked it, and she thought, "Wow, this tastes good." And then she started feeding herself more and more,
You
and
need
then slowly
patience.
the
You
mess has
just need
reduced. So
patience.
I think that was for me also very important.
Absolutely.
And you need to be okay with things getting messy.
So I think in my nutritional class, I keep saying that don't get a bib for your child, get a apron for yourself when you start solids with the baby,
Yeah.
and also that don't really fidget to. I mean, don't really get a bib for your children while they're starting solids, because what they really do is just fidget with that bib again and again. It's rather just put their feeding
Mm.
clothes on, let them make a mess out of it. The other day you'll get
Yeah.
just get one more pair of feeding clothes and just keep altering that. I think that would make sense.
Yeah.
And but yes, you require a lot of patience, Gitanjali. So things which
Yeah.
are which take a lot of time and hard work of yours right there is going to pay you off later. So yes, I think you did a good
Mm.
job.
Isha, I feel like I could talk to you for hours and hours. There are so many things and so many questions that come to my mind that I want to discuss with you. But we'll leave it at that for now. I have one final question. So the podcast is called The Confused Mother, right? Which is
Yes.
representative of all of us as mothers. What advice do you have, if like one piece of advice you have for the confused mothers out there?
So firstly, the prime line that I would say with this question is go with the flow. Start just being present in the moment. Don't think about the future. uh, don't spoil your present. Sometimes you're just spoiling your present thinking about and dreading about the future. So please live in the present and go with the flow. Number two, if you're still pregnant and somebody listening to this, please do your post birth preparation in pregnancy. So we
Yeah.
usually do all these sessions about breastfeeding, post-birth care before you give birth. Because hunting for help after giving birth is too much, because you need to take out time for your recovery, your child care, and the classes doesn't match well. And also, all your stuff in case you are in a nuclear family all alone, for example, you in Germany, it gets difficult. So get yourself prepared. Number three, if you are somebody who is struggling with breastfeeding, lactation consultant will be at your rescue. So kindly
Yeah.
go and meet her, online, offline, as is convenient for all of you. Number fourth, there is an entire segment of post birth care, which can be from postpartum blues, which is also an important segment of recovery,
Yeah.
um, to dietary advice for the recovering mama, to taking care of the newborn from diaper rash to colic to cradle cap to handling vaccines to fever to
Everything possible.
everything,
Yeah.
cough and cold for that matter. You cannot give medicines to your child till 3 months, right? And if
Yeah.
your child has cough and cold, then what? So there
Yeah.
are postpartum support class, for example, one that we conduct. There are many pediatricians who must be conducting also the same. Try and attend those. If you have time, also do the first aid class. Again, it's not a very cultural thing in India to do a first aid class, but I think that should be incorporated. Beyond that, listen to all the mouths, all the voices around, but then listen to your intuition right in the end.
Yeah, that's I think very, very important. Oh, it was so nice talking to you. I'm really, really happy that we had this conversation today, and I want to say thank you so much
I'm so
for
glad
being
that
here.
you gave me this opportunity. I mean, I love talking and supporting parents, and I think I can go on and on and on without a break. But I think it's very important that whatever message has been sent, which also I forgot to mention in the takeaway right in the end, that remove the fear out. If you're fearful, you will not enjoy. Sometimes you won't enjoy not just your relationship with the baby, but also sometimes the relationship with the partner, which also goes for a toss immediately after birth, because you
Yeah.
all are struggling, right? As individuals, everybody's struggling. So find your own space, have your me time, let him have his me time. You have your couple time, you have your baby time, and give each other also, separate times. So,
Yeah.
yes,
Your space as well. Yeah.
yes.
Okay. Yeah, thanks again. That was also a very, very important point. Thanks so much, Isha. If you liked this interview, why not subscribe to my channel? Share the story with anyone you think might be interested in it. To support my work, you can do so for just the price of a coffee. You can find the information in the show notes. Thank you.